Hey parents, Dr. Devin here from Rising Health Family Chiropractic. One of the most common questions parents have for us when their baby comes in with a flat spot is, how can you help? Is this normal? Is this going to change? What's causing it? Is a helmet going to work? Or do I even need a helmet? These questions are so common because it's something that parents really have never thought about, is what really is the root cause of this? And if I go that route for a helmet or physical therapy, what is that going to do and what is that going to help? So that's why in this video, I really want to talk about getting to the root cause of plagiocephaly. To do that, we want to look at three of the main causes and then even show you a research study that talks about why it's so important to get help for it. And not just the standard treatment that you see with a helmet or physical therapy. So, first of all, when we jump into this, there's really three main causes that goes into head shape. And the first one is probably what you're most familiar with and what you're thinking about, right? 20 to 25% of the time, babies change their head shape just based on how they're laying, with them laying on their backs to go to sleep. The majority of them is you're going to see that put pressure on oftentimes the occiput, the back of the skull, and that causes that pressure to then flatten out. And that's why that's the most common that you'll see. A lot of times you'll see a little bit of wear in the hairline. They'll have that little bald spot in the back, and that can cause varying degrees of plagiocephaly. Now, that can be part of the struggle, right? So that's why we see plagiocephaly pop up a lot in babies before 4 months because they might not be doing as much tummy time. They're naturally just going to sleep more and spend more time on their back. So oftentimes that can be part of the problem, but it can also accentuate the problem, especially if number two is the case. And number two, oftentimes, is a condition called muscular torticollis or struggles with movement in the neck that can also cause plagiocephaly or flat spots in the head. Simply put, if a baby isn't good at turning their head very easily from one way or another, or oftentimes, moms will say, I see my baby, they just like to sleep on this left side. And because of that, that's going to influence the plagiocephaly on one side or the other. Again, this is why it's so important to get to the root cause. The root cause of that flat spot or that misshapen cranium isn't because of anything literally going on with the cranium itself. It's because of the movement and the motor system in the neck that isn't comfortable. That's actually where we come in as chiropractors, and we can help that get into really just get to the root cause to change that movement. Help them be able to not only sleep more straight and be more relaxed, they're nursing better, they're latching better, they're able to move more comfortably. And in fact, a lot of colic, constipation, reflux is all rooted in the upper cervical spine. And that's why it's so important to really look at that case of the root cause of plagiocephaly. Now, the third, this is something that not often parents really think about, but we really dig deep as pediatric chiropractors. Birth interventions, including forceps, vacuum, or manual assistance, those can play a really big role in plagiocephaly. And the reason because of that is because babies, when they're coming out through the birth canal, there's a lot of pressure that comes in with these contractions that's designed to naturally shape the cranium. It shapes the cranial bones to move them in the right places and really get that good fluid flow, good blood flow, good CSF flow as well, the cerebral spinal fluid, to get them to really just engage on a symmetrical level. If there's any type of birth intervention that's going to change that, that's going to create a restriction of movement even higher up than the neck in the cranium. In fact, they did a study in 2018 and they found that the use of forceps or vacuum during delivery was associated at a significant risk of plagiocephaly, simply because those cranial bones are so movable that if you put extra pressure on one side or another, you can be born with that and that can then settle in. And if that's not helped, it can stay that way. Now, those are the big things, right? And as a parent, it's not always the things that we think of with that. So, some of the signs that you might be seeing if you're curious, okay, what is this plagiocephaly? Why is this happening? We talked about the visual flat spot on one side of the head. That's going to be the big one. And especially if that flat spot is asymmetrical, meaning if one side is more flattened than the other. Another thing, is if their ear, if you look at them and one ear is lower and potentially shorter than the other or pushed to the front, that can be a sign that's a little bit more severe. You can look at the eyes and look at the eye shape. Is one a little bit smaller than the other? You can look at the frontal bones. So the forehead, is one pushed out or bulging more than the other? And in the toughest cases, oftentimes those asymmetries will cause one area to be more flattened and the other area to be more extreme. But here's why it's so important, and here's why I'd recommend seeing a pediatric chiropractor to really get to the root cause. And I want to show you this study here because this actually was super interesting to me. Is development in toddlers with and without deformational plagiocephaly. They did a study to actually determine if there was a heightened risk of any developmental delays based on cranial shape. And this was so important for parents because so often we asked our kids, we're like, hey, is this going to affect them down the road? Other than them maybe having a misshapen head, right? The aesthetic value. And especially if you have a lot of hair, you can't really tell, right? For guys, maybe you're going to be bald later in life, get that checked early on with it. But there's a bigger risk than just what it looks like. In fact, they found that there's a heightened risk of developmental delays in infancy with patients of deformational plagiocephaly that lasted into the toddler years. In fact, the conclusion of this is toddlers with plagiocephaly continue to exhibit evidence of developmental delays relative to toddlers without plagiocephaly. So the structure, it determines the function of the body and can actually slow things down developmentally. And that's why it's so important. In fact, when we talked about, the torticollis side of it, the movement in the neck, the flat spot, and the difficult birth, there's a lot of other infant and pediatric struggles that get associated with it, like you mentioned, colic, constipation, reflux, just not feeling comfortable. And that can lead to other bigger things later on that we see so often in practice. And that's why it's so important to not only change the head shape, but make sure the movement, make sure the nervous system is all in a really good place and really do that naturally. So if you are a parent and you're looking at all this and you're saying, what do I do? We would love to chat with you. We would love to help you answer those questions I talked about before. How bad is this? How can we help? Is this going to be, how is this going with a motion restriction? Is it due to their birth? Is there something more going on? We want to help. So feel free to share this video, ask questions below. And if you want to set up a time to talk about just the uniqueness of your baby's birth or where they're at now, maybe more developmentally, let us know. We would love to do that too. We're here to chat and we're here to help you and your child with plagiocephaly. God bless.